Next here, suddenly at here complaints of shortness of breath, chest pain, hemoptysis, history of cancer, breast cancer, positive, BP's vitals shows BP to be 120 by 80 while her pulse rate is more than 100. That means tachypnic. No history of surgery or immobilization. So now you suspect it as a case of pulmonary embolism, right? So now this pulmonary embolism, among the following these options, best suited investigation to rule out pulmonary embolism will be what? Whether it is a normal chest x-ray, a normal ECG, or a normal ventilation perfusion scan, or a normal ventilation scan. So see, as I've already mentioned that it's a case of pulmonary embolism, so we will first look at the Wells criteria. Wells criteria for pulmonary embolism, suspecting a case of pulmonary embolism. So what is this Wells criteria all about? So the Wells criteria comprises of few points which are given certain specific scores. So if you are suspecting it to be a case of pulmonary embolism, so there are signs and symptoms of DVT, you give it a score of 3. Or there is no likely diagnosis other than pulmonary embolism based on clinical symptom, that is you have already ruled out pneumothorax or a foreign body aspiration. So you give it a score of 3. Other than this, if there is history of prior history of DVT or pulmonary embolism, you give it a score of 1.5. Then if the heart rate is more than 100, again 1.5. And if there is immobilization for more than 3 days or surgery within 4 weeks, again 1.5. So here, other than this, if it's a cancer patient, you give 1. If there is hemoptysis, you give 1. Right. So from these points in our question, what we find similar is signs of DVT. Yes, so I give it a 3. Not given heart rate more than, give 1.5, give 3. And what else? There is cancer in the patient, you give 1. So we get a total score. Yes, we have added hemoptysis as well, so it is 1 again, 1, 1, 3.5 plus 3, 6.5. So now what they say is that the score, if you have a score above 4, that means it's likely to be pulmonary embolism, right? It's definitely gonna be pulmonary embolism, and you immediately do CT pulmonary angiography to confirm. If it is less than 4, then less likely pulmonary embolism. To rule out, you do D-dimer test, which is a fibrin degradation product. So now if this fibrin degradation product is present, which is above 500, so that means you sure that it's a pulmonary embolism, you do CT pulmonary angiography. But if it's not, if it is less than 500, then other diagnosis, right? Now next what we do here is, in our question they have asked, the definitive investigation of choice is not being asked, but rather they have asked to rule out pulmonary embolism by the following general tests that we do. How to rule out? So if it comes negative, that means if it's a normal scan, so which will be likely telling me that there is no chance of getting pulmonary embolism. So out of these, the most sensitive marker is a normal ventilation perfusion scan. Now the normal ventilation perfusion scan means most sensitive marker for detecting pulmonary embolism, right? So it's the most sensitive one. How we go further, that